Thank you very much for the invitation to participate in this great podcast idea. My name is Mario Gössl. I'm one of the interventional cardiologists at Allina Health, Minneapolis Heart Institute. And today we're going to talk about chilling insights, cold plunges, hydrotherapy, and cardiovascular health. Something that really excited people here in the last several months. And it seemed, talking to some of the most recent reporters and news outlets that I talked to, it seemed like there was a little bit of a revamping of this question after this show. There was a show in which Chris Hemsworth showed his hobby, which is probably more like swimming through the Arctic Ocean and etc. But overall, cold plunges, the idea of cold water, what it could do for you, how good it would be for you, came up again. So maybe this is a worthwhile show. I haven't seen it yet, but it came up in the press then again, where he, I guess, had a little bit of a competition with one of his colleagues. At the same time, on your left side, there's also this question of cryotherapy overall without the plunge, but there's companies or vendors that are offering kind of a cold cryotherapy for the whole body. Question is, does that actually do something for your health? At the same time, though, as this grew more popular, and then, the idea of like a plunge in ice cold water, there's also enough warnings that came out at the same time by, for example, the National Center for Cold Water Safety. And it's a website I've never seen before, but they made pretty clear in their warnings that plunging in an ice cold sea or wherever you might want to plunge into is not going to be the safest for everybody. And they point out that even good swimmers may or may not be able to save their own lives, even if it's just like a few meters of swimming, if you get into a certain shock situation. And they highlight these stages of immersion into water. So how deep and how long you're going to be in ice cold water. And they have, 4 specific scenarios that can happen. And, you can read through this later, but cold shock and incapacitation, now those are really the most important ones, I think, just to remember, is that this first threat to survival is this cold shock that you might have when you go into a lake. Even in the summer, if people have been up north, the lakes are very cold and you're in a kayak and it's super hot. But if you jump into the lake, it's the difference in this temperature is so immense that some people don't make it if that happens. And you also have to remember that the muscles and nerves are going to cool down so quickly that even if you think you're very strong and you should be able to make it, you may just not, because your body gets into a reaction that you cannot predict unless you potentially have trained for it. So in summary, what are really these reactions that, let's say, the dangers of this sport or event? And what you should remember is that there's going to be a sudden increase in heart rate, breathing, and blood pressure, and that is that cold shock. And as you can see, and we'll get to this later, in certain folks, this increase in heart rate, blood pressure, and breathing is not going to be a good idea with their pre-existing conditions. There's going to be a blood rush to the body's core. You can imagine that, of course, your body is going to try to have your main organs survive. Arms and legs will have diminished circulation, and that's where you lose the strength and coordination. And the coordination is a very big point. Even if you still think you know what you want to do, your body might not react in the same way. You also have to remember that hypothermia or cold water is cooling you down 25 times faster than air. So even if you're outside and you say, "Oh, this is really not that cold, I'm prepared," imagine 25 times faster and you're going to lose consciousness. Beta blockers may not be a good idea overall because your heart rate may not be able to adapt quick enough. We'll get to that. And then go slow is one of the advices I think that everybody gives. Adapt to it, right? So deep or deep breaths for like cold air, just to make sure your body gets used to, this cold feeling. And then even rinsing your body with cold water, it's called priming, just to make sure your body is ready for the jump. And then another very good advice is that you shouldn't go alone. You should go in pairs, just in case something happens, that someone is there, either help you or at least ask for help. Many questions always about the health effects. So how strong is the evidence, right? So we're having this mixture of like a fun talk here today and some, weaker evidence, but is there really strong evidence for cold plunges? And I think the way I looked at it in the literature that I found, even, based on AHA comments and things like that, it's one review article is here. You can certainly read it if you like. But the main conclusion is that there is a little bit of a lack of evidence of mechanism, right? And if you really wanted to dive deeper, you would have to do really more, the classic trial studies. And of course, not sure that anybody at this point would be interested in that. But to really have harder evidence, you would have to do, more studies or trials. This is a very busy slide, but I wanted to show you that there's, in these papers, really, very detailed analyses, obviously, of what temperature does what. And then they did actually analysis of blood pressure, of metabolic rates, even, diuresis, so how much your kidney is going to spill out and what you make you pee. And all these kind of things are actually analyzed. And there's some evidence that if, people did this and were analyzed, that you can actually measure certain effects. And as a summary, they said, if you have regular winter swimming, it could decrease your tension, fatigue, memory deficits that you have. It could have other effects of vigor activity scores, relieve pain in rheumatism, fibromyalgia, asthma, and other things. We're going to get to some of these again. So there is some evidence that in some people, this kind of, cold swimming, not just one plunge, but like a more regular activity, could have some benefits. Just maybe a few slides on a few things that people are probably mostly interested in, but hydrotherapy, or this water effect therapy, it increases your heart rate, decreases blood pressure and diastolic and systolically. There's also some evidence that your cardiac output at certain temperatures might increase. On the respiratory system, it could help with certain exposures to infections. Not that your infection can be healed if you jump in the cold water, but you could prime yourself, make yourself more stable or less prone for infections, for example. Those things have been analyzed. Nervous system, there's a little bit of questions. There's also knowledge that it might have some antipsychotic effects, even things like depression or stress-induced analgesia. Those things have been looked at. Musculoskeletal system, I think that's where we probably know most about it, because as you can imagine, these very high-profile sportsmen and such, they often do certain water therapies pre or post, events. And I think that's where the most evidence is for better recovery, less injuries, less inflammation. Even in fibromyalgia, there's some evidence. So that's where I think maybe I feel like there's the strongest evidence for that, also the easiest to achieve. But when I looked at everything, and these questions came up, months ago when we had our first media requests on this, I remembered that from school, that there was actually this pastor, and everybody knows him actually in Germany, Pastor Sebastian Kneipp. You can see when he lived. But this concept of hydrotherapy is actually not new, as you can tell by the dates there. And he has published a very old book that I actually found on Google, so everybody can find it. It's called My Water Cure, and you can read the whole book on Google. It's from 1897. It's published, but I think he had earlier versions. And what it is important to note there is that he did not just focus on a certain water hydrotherapy. He really made it more a holistic approach. And I think that's where what I would like to stress in this whole talk too. There's this, maybe the fancy way of one famous actor jumping in a lake, and why don't we all do that? It's a fun project. Be careful with that, because certain people may not be, well served doing that. But if you think about it, like I'm interested in learning about hydrotherapy, cold water exposures, etc., what can I do for my health long term, not just one event? Then I think you can come back to, for example, these really yeah, people that really led the whole way, even like hundreds of years ago. And here's his 5 elements or pillars that he always identified. He said, water is, of course, the water exposure. We talked about that as one big item. Exercise within water or outside. Nutrition, right? Things that we talk all the time. Then herbs. So overall, the concept of healthy food and how healthy phytotherapy could help with that. And then mindfulness. Now, it's things that we also talk about very often recently. And as you can see here, these are some examples I'm going to show you here. But in Germany, actually, you can go to what we call Kur. So it's kind of like a spa situation for a few weeks. And some of the insurances cover that actually for certain health conditions. And there's 53 locations in Germany right now that offer this kind of hydrotherapy, so cold plunges is not really that new. And there's some evidence that in heart failure, venous insufficiency, and immune systems, that there's some effectiveness. There's actually about 89 studies that were reviewed at some point. There's also some evidence that in kids, for example, allergic reaction, recurrent colds, or neurodermatitis could be treated with this kind of approach. And it's not that difficult. The UNESCO actually took it on as a heritage in 2015. And you can see here these kids, going through the water in certain temperatures. So this is really the whole concept of doing some exercise in water, right? Some people do it here in swimming pools, right? So that's where it's really coming from. And you can see some of the nice outside pools where people can walk in that water, certain temperatures. Then there's these more fancier pools where you can go from one temperature into the next on the left side. So, as I said, more than 50 locations. And then this is like what they would also consider water therapy, hydrotherapy. You can do it on your arm on the left side. It's more for your circulation. Then you can do it also whole body, upper body, also more for circulation. It could be calming, as they say here in this German description. And then you can see for venous insufficiency, they often do that also just for the feet. So very interesting therapy. Now, he, Kneipp, so this pastor, he had like the 10 commandments for himself, right? So what are the most important things to remember for this hydrotherapy? And there's a quote from him, and I think that's kind of important, makes it all, sound really well and put together. For the various applications of water, tend to remove the roots of the disease. They're able to dissolve the morbid matters in the blood, to evacuate what is dissolved, to make the cleansed blood circulate rightly again. Finally, to harden the enfeebled organism. So it's kind of like really putting it together, of course, with the, more old language. So for him, cold water, and some of his pupils later weren't necessarily completely agreeing with that. So they were, not saying cold, it has maybe a mixture, but for him, it was really the cold water was the essence of the water curement treatment. So bringing back that idea of, really swimming in cold water, the cold plunges, right? And he said, I follow my principle founded on experience. The colder, the better. In wintertime, I mix snow in the water for shower baths when they are for healthy people. So healthy people, right? Bringing back this idea of not everybody, but really, really cold water. So let's go through these commandments and then, the talk is going to finish. But the first one was, cold water is applied only if the body is warm. So that brings back, this idea that if you're already cold, shivering, something's going on, and of course this was in the 1900s, right? Then you probably shouldn't do it. Feel well. It will divert the blood. You will be seeing this blanching, and then the colder that water is, the more intense is this reaction, right? That's what he was looking for. Then we have the start with wetting chest and temples. Remember what we said in the beginning, there was even now these recommendations by safety units to say like you have to get used to it, right? So he says a beginner should just take cold water out of the basin and apply it quickly to the arm and chest and upper part of the body, and then put it on the clothing at once, without drying the skin without a towel. It's an old custom to wet the forehead, the chest, and the temples before taking a bath, right? So but that's the idea of getting used to that temperature, right? And then there's all these evidences that you can read later if you want to, about the diaphragm flags and all of these kind of things. And it's important to realize that in the 1900s, without having any evidence, he realized, obviously, don't do it too quickly and without preparation. No cold water applications after meals, right? So if you do a water plunge and before that you have, your French fries and then you have a fun event, that might not be a good idea. And he realized that also. No cold water treatments longer than necessary, right? So usually he did that actually quite quickly, and that's why you see these water pools are pretty brief. So you do quick runs through them. You want to see that reaction, but overall, you're not going to be extensively doing. So, for example, now swimming through the whole ocean, I think that's a different approach than this hydrotherapy where it originated. Yeah. Body must never be wiped dry. So this is a little bit, that time, because they wore different clothes and such. But his concept was that, coarse porous linen or cotton clothing should be put on later on as also a therapeutic approach. Now, how we approach this nowadays is probably very different, but at that time it was kind of interesting that they did it that way. Get warm, dry, and comfortable, right? So the shortest time for exercise after application ought to be at least 15 minutes, right? So you do an application and then you do a little exercise, or you do outdoor, indoor walks and things like that. So he kind of put it together again, saying that exercise and the water therapy, mindfulness is one big thing. No excesses, so that's important too. Yeah. For example, he said sick but otherwise healthy people may take 3 applications a day during the summer and 1 every day during the winter. Healthy people may take the 3 applications every week. So you can see this, it's a variation in there, but you can also see it's not just one time, it's more like a consistent integration into your life, this hydrotherapy. Again, he has, some comments here. The individualization is important, and I think that's also important for this talk. Not everybody can jump in a lake and be safe and then has a benefit from it. I think talking it through, thinking about what your comorbidities are, and then decide if that's something for you, maybe talking to a physician, I think is definitely important. And as you can see here on the last one, for example, there were a little bit disagreements with, his pupils who rose up with him and then decided to say, for example, there's a limit. If the water is too cold, no stimulation in the blood vessels, but lameness and relaxation would be the consequence, right? So they wanted the water above 45 degrees, which obviously if you go in a lake, it's going to be different. But you can see that there's maybe even some disagreements in the people who've used it consistently, how cold the water should be. Light clothing, comfortable clothing, even in the winter. Again, it's more like, for that time. I'm not sure we can apply it. But then really successful water treatment depends on the right kind of food and drink, right? So that was important back then as well. And I think here too, again, if you do one plunge just out of fun, it may not apply, but if you want to integrate it into your life, then you shouldn't just expect the water is going to cure everything. I think you should also follow, for example, Kneipp's idea of mindfulness and also the right food and drinks with that kind of therapy. And then sleep and rest in the correct proportion, right? So obviously that plays a role too, again, in the whole concept of how to treat your body and not do just one thing, expect everything is gonna get better, but just see in various parts of your life how you can improve health, and sleep is obviously one important part. In Germany, there's a little bit of, there's a PhD thesis about this, and there's an more systematic reviews through these theses. And what they really say at the end of the day, this particular Kneipp therapy, so this therapy that we just discussed, the 15 minutes, 20 minutes exercise and mindfulness, there is some increase in quality of life for CHF. And I mean, I think quality of life is a measurement that, even recently was one of the main outcomes for trials. So I think if that's an outcome, we should, say this might be an interesting part of therapy. Hypertension, significant reductions are seen. Menopause, improvement in symptoms. Venous insufficiency, improvement in quality of life again. Polyneuropathy, the same in symptoms. Dyspepsia. Many people might be able to reduce their medication. Sleep disorders improvement. And for lung diseases like COPD, there is the idea of immunoboost and reductions in infection. So if you look at this, you really wonder, why are we not having 53 locations maybe in Minnesota alone, if this is such an interesting concept? Maybe something we have to consider as a research endeavor. Anyway, so it's kind of, it's a fun talk, right? But at the end, there's actually some seriousness to it if you really want to get into it. So I'm sure there's some questions in the audience, and I really very much appreciate the opportunity to give this little podcast here.
Thank you to Dr. Gössl for your time and expertise during today's On the Pulse session. Fantastic presentation as always. And hello, everyone. My name is John Rickert, the virtual event lead here at the Minneapolis Heart Institute Foundation. We'll just be jumping on to help facilitate the Q&A. And today, the questions that we have prepared were all submitted prior via social media, registration, and other outlets. So thank you to our registrants who did submit a question. But please also feel free to add additional questions using the Q&A pod, which is located at the bottom of your Zoom screen, as these may be addressed in a future On the Pulse session. So the first question that we have, the question is essentially differentiating between ice baths and hydrotherapy and cold plunges. So the question is, cold water immersion, what falls underneath that umbrella would be cold plunges, hydrotherapy, but also ice baths. And, from what I understand, ice baths are essentially a tub that's filled with a temperature controlled water, sometimes ice as well. And you'll see these in places like gyms. There's several companies that offer these for the home. But if you could just speak to, ice baths and how that falls under the cold water immersion umbrella, and if there's any sort of difference between an ice bath and a cold plunge, or if they have similar effects.
Yeah. I mean, I think, especially when you look back into the old school by, Pastor Kneipp and his scholars, I think the more benefit I would expect from your ice bath, if you do it right? If you just like see it as a challenge, right? To say, okay, how cold can I get, before I get in pain, right? That I don't think that's, I wouldn't take it as such, right? But if you want to read about, I mean, everybody can read these commandments, right, that he wrote. I mean, they're online actually in English, which is kind of funny. And if you just follow those like guidelines, right, what him and his scholars put out, like 15 minutes, 20 minutes, what kind of temperature they found, the best for their effects. And if you do it that way with your ice bath or water bath at home, I think, that's one thing that you can do, and might, is it, the last slide shows what the effects could be, right? I don't think it's a bad idea, right? I think, as I said before, I'm kind of surprised now that I read about it again, that we don't have more of that, at least as I know. I think in residency, I've seen it at, Mayo Clinic down in the basement. I'm not sure if they still do it, but I haven't really seen it anywhere else, this hydrotherapy concept. The cold plunge itself, I'm just not so sure about just the plunge having a major effect. I think that's really more the shock therapy, and it's like social event, fun, do it with 10 people. Can I do it? Can I not do it? Kind of that kind of a challenge. But I don't see that as a long-term effect if you just jump in the lake every now and then.
Yeah. Well, thank you very much for that. And I think it's fairly safe to say, before you just fill a tub with super cold water and ice, you should look into how cold should it be. Talk with your provider about the safety precautions, how long you can be in there, and what sort of effects you can expect from that.
For sure.
So the next question that we have that the audience submitted, the question is, can cold plunges have long-term benefits for cardiovascular health? If you could speak to that, that would be great.
Yeah, might quickly address in one of the slides, but it seems like, and again, none of it is, I think, the very strongest evidence, right? I think people, it's more anecdotal experience, group experience, and things like that. But it seems that quality of life, which again, as I said, in some trials is the main outcome, right? Um, can be better in CHF, heart failure. It can be in, venous insufficiency, cardiovascular health, right? It's definitely an improvement there. And, risk factors like, for example, the high blood pressure seem to have some effect too. So I think those three, they seem to have pretty good evidence that there could be a benefit. Curing a disease, I haven't really come across that. It's more preventive, right? And more towards the how you feel, and yeah, more a lifestyle, I think. But again, just the water therapy, I don't think it's gonna cut it, right? It's again about nutrition, some sort of exercise, mindfulness. That's where even in the 1900s was important.
Yeah, absolutely. And it seems like, this could be a therapeutic benefit if it's part of a regimen for a larger holistic approach to overall wellness. So let's switch gears here a little bit and just talk about safety. The next question is, what should someone with heart issues consider before trying a cold plunge?
Yeah. I mean, I think if you have really a serious heart condition, let's say, you know, major heart attack with significant coronary disease, a bunch of medications, heart failure, arrhythmias, right? So any kind of like um, supraventricular, ventricular arrhythmias, atrial fibrillation, things like that, right? I think you should talk to your cardiologist or maybe start with your primary and say, okay, I wanna engage in this. How do I do it best? And I'm not sure that everybody has an expertise answer on that. But I think one thing is for sure, and as you can see again in the 1900s, um, take it slow. Start with warmer temperatures. Try to decrease the temperatures and see what feels comfortable. Also see how your body reacts. But I think the more comorbidities you have, the more risk you have, the slower you have to engage and the more questions you have to ask before you engage, right? I think if you think about the immediate immersion and the risk with that, that is the highest risk. I mean, if the healthiest people can die in a lake, then obviously with comorbidities, you're even more prone to do that, right? And so that is super high risk. I would definitely ask, right? And if you then think about more like the water therapy, hot and cold therapies, I think that's where you might even be able to do it yourself and go slow or, ask physical therapists or people that have some experience in kind of introducing it for you.
Absolutely. And thank you very much for that insight. So, along those similar lines, who would you recommend or who could benefit from cold plunges and who shouldn't cold plunge?
Yeah, I mean, from the readings, it seems like if you have you know, some of the major cardiovascular health problems could benefit from hydrotherapy, right? Again, with everything, right? Not just the water, but looking at as a holistic approach. I think that there is some evidence for chronic lung diseases, yeah, overall to boost your immune system. So any kind of disease that would benefit from that. And it seems like, at least in Germany, people are thinking, kids in the 3 to 6 years age where, these allergies develop, that there could be some benefit. So I think that's where the strongest evidence comes in. Yeah, and I'm actually somewhat excited to see what institutions are actually offering something like that. And maybe we're just not aware of it because it's more silent, but it would be a nice option.
Absolutely. Thank you very much for that. So let's switch gears here just a little bit. So this question that this audience member submitted, the question is, in your opinion, are cold plunges here to stay or just a wellness trend that will fade in time?
Yeah, it seems like there's this whole group of people that are doing this and we just don't know about it, right? And then it just pops up in social media and we all realize, oh, this is going on. Um, I think there's like really it seems like more like a Northern European culture that actually does that, right? And people are either doing it all the time and some people just do it a couple of times for a social event. So I think it's gonna stay because it's old, right? It has been there for now what maybe it's sometimes soon 200 years or something, right? So it's gonna stay. Um, I think the overall adoption by a majority is I think it just depends on how many shows you're gonna see on any kind of channels and you want to try it. Um, overall wellness, doesn't have the greatest uptake, right? It's like modern for a few months, years, and then everybody forgets about it again. So I'm not sure, but I think it's going to stay, but I don't know that there's a greater uptake. I don't know.
Yeah, absolutely, and appreciate the insight. Thank you for that. So how do you know if cold plunges are working for your heart?
Yeah, I mean that's a really good question, right? And again, I wouldn't I think the cold plunges is this the main attraction here to talk about, right? But I think if you do a regular hydrotherapy, let's put cold plunges into that, right? Um, I think what you would see if you measure things, right? You should see, of course, that you have a little bit effect on blood pressure, right? That you feel better overall, and that might be, a mindful thing that actually overall improves your health. um, I'm not sure that you can see other things, right? So, I mean, there is these ideas of certain laboratory parameters that could also change, but I don't know how strong that is. I think if you feel better with it, you feel, your venous insufficiency is better, your heart failure feels just better, your heart rate is a better control, your blood pressure better. I mean, it's all good, right? And no matter what you find in your life, this could be one of the things. Again, I think the shock immersion is not what I would focus on, right? I mean, I would focus on like a longer plan, right? So yes, cold water and swimming if you want to do that, but just to shock your system, like every time you do this for a few times in the winter, I don't think that's going to have a long-term effect.
Yeah, makes sense, and thank you for that insight. So we just have a few questions left here. The next question is, what excites you most about the future of cardiovascular wellness, including things like cold plunges and hydrotherapy? Are there any other wellness practices for immediate and or long-term cardiovascular wellness that you would recommend?
Yeah, I mean, always a good question, right? Yeah, I don't know. It's always hard. We always are supposed to give some recommendations, but at the end of the day, um, I see it, I think rather simple. If you have something that you really enjoy, right? Uh, then use that as your, way of engaging your body something else other than your work stress, work out that you do up and down the stairs at work, and just find something that distracts you from that daily stress and focus just on your body. If that's hydrotherapy, perfect, right? If it's yoga, which I think is we talked about that before, I think it's a very good outlet. It could be a very calming procedure for you or technique. So many aspects of it, and not many people, I think, really know about it or engage in it correctly. Um, but yeah, any kind of exercise, any kind of mindfulness, whether now it's yoga or some practice like that, I think has a benefit for you, right? And I think that's the most important thing. I think that yoga has gotten some attention too for rehabilitation purposes and things like that. It's relatively easy, right? You just need a mat, and then you don't have to have the most fanciest equipment. So that's good about that. Everybody I mean, almost everybody can do it. Um, Hydrotherapy, I know that many people do water exercises in the pools. It's more an exercise in a relatively warm pool. Now, I mean, maybe some of the pools will decide, hey, let's go with really the old hydrotherapy approach. So I could see these things catching up. Would be nice. And what I also want to say is like really I mean, we're not going to see that in the United States, I think, but in Germany and some European countries, the idea of a chronic disease and going somewhere for a few weeks and having these spa experiences is really very common, you know, and it's paid by the insurance companies under certain, of course, regulations, you know. But I'm not aware that that exists here. Maybe I've never heard of it, and that's where. But I mean, people here are basically having a chronic disease, you know. Then they go to rehab, which is more exercise, and then they're left alone again, right? But but they're in this environment that they have to go work again and all of that. And a European approach, at least until recently, is that you actually disengage from that stress that you had, right? And then for a few weeks, you actually do a treatment, sometimes with your partner too, right? You can do that too. I know it's going to be a challenge for the healthcare system if we would do that, but I think there is some you know, valid improvement expectations with that.
Yes, absolutely. Really appreciate that. So as you were saying that, it made me think of right now we're talking about cold, right? Cold plunges, ice baths. What about the opposite? Another common practice is saunas, even hot tubs, things like that. Does that have a similar effect and similar safety precautions when it comes to cardiovascular effects? If you could just speak to that, I think that would be interesting for our audience as well.
Yeah, I mean, Kneipp actually combined it sometimes, right? So where, you know, cold and then warm, you know, you kind of get warm exercise in your clothes and then you warm it up again. So this whole warm cold concept is obviously there. I think sauna, again, from my, you know, my ancestry is of course European, very popular. Almost everybody, I mean, not everybody, but a lot of people have a sauna at home, right? Even the smallest ones. So very popular there. And again, almost the same recommendations because of that heat, the sweating, you know, and the effect of that on your body, higher heart rate, sometimes blood pressure can actually go down when you sweat and get warm, right? Again, making sure that you're not suffering from a major condition where that could be a problem. And again, also not doing any excess of that would be beneficial. I'm not like a sauna expert, but I mean, for example, my dad has cardiovascular disease and he really benefits from it a lot, right? He does it in a cautious way. And there's some swimming that can be, you know, go along with that. Some people actually do some, you know, cold baths right afterward. And I think if I'm not mistaken, there's a lot of Finnish history with that, right? So maybe at some point you can find someone as an expert on sauna, and it'll be interesting to compare what they have found on that.
Yeah, yeah, absolutely. And I think an overarching theme that I'm sort of putting together is, exercise caution, take things slowly, do things one step at a time, and of course, consult with your cardiologist or general practice provider just to maintain the utmost safety.
Yeah.
So let's just do one more question here, and this has to do with research, right? So the question is, what research are you aware of that is currently taking place, or any recent research that has just recently been published about this topic that you find interesting or useful?
Yeah, I haven't found anything like recent. I found, you know, review articles trying to put it together, right? Some people have reviewed hundreds of smaller papers, right? And try to make a nice overall summary. Um, I haven't come across anything really recent that I could, you know, mention here. It's really an old practice. I think it's even without evidence, strongest evidence, something that people always have done, right? And it's one of those things. I mean, I could also say, how do you know tennis works for you, right? I mean, has anybody done a tennis study? You know, uh, probably not. Um, but we know that if you have fun with tennis and you don't injure yourself and you do exercise every week, 3, 4 times, whatever, and it's going to be good for you, right? So I think that's kind of like the same idea, right? So this is just a different way of these 5 pillars, put them all together. But if you ask me for strong evidence or research recently, I'm not aware of that.
Absolutely. And it sounds like, perhaps maybe more research needs to be conducted.
Mhm.
So that is all of the questions that we have prepared for today. Is there anything else that you would like to say to our audience before we sign off?
Yeah, no, I think we covered it all. I think the main thing to remember here is really that there's these two things, right? The cold plunge, social event, cool, let's try it, but be careful, right? And this whole concept of incorporating hydrotherapy in your, chronic disease or even wellness management, right? And I think the latter is really interesting. It would be more super interesting to explore. Cold plunge is, I would say, be careful, right? Everybody has had an experience in a lake, even in the summer, so it's not for everyone, and it's not gonna just cure everything because you jumped in that lake, right? So these two things have to, I think, be seen separate. And if you do so and take caution, I think then you can have fun, with the one, and the other one can be your wellness aspect. But be cautious. Make sure you read about it and how you should prepare yourself. And definitely, I would say don't have 3 drinks and a big steak and then say let's jump. I think that's going to be a bad idea.
Absolutely. Well, that's all the time that we have for today, folks. A big thank you again to Dr. Gössl for presenting on this excellent topic. And thank you to all of our attendees who joined us this afternoon. We do appreciate your participation. And with that, thank you, everyone, and have a great rest of your day. Thank you.
Yeah.